Hi, thank you for coming to my channel. Today I want to talk about protective factors. Someone who has a lot of protective factors or strong protective factors are less likely to experience severe mental health issues. It doesn't mean that they can't, but they're just less likely. And a person that does deal with a really traumatic time in their life or incident, because sometimes it's not just depression or anxiety, it could be an unexpected death in the family that you have no control over that throws you into a place where you're really struggling, whether you wanted to or not. People who have protective factors tend to bounce back more because they have stronger support systems. They have more of a connection to themselves and grounded. So we want to kind of dive into what are these protective factors and how do you increase them? Okay. The first category for your protective factor is your social supports. Now, let me say you don't have to have a strong, because there's kind of a rating to this. I would ask the client, okay, when it comes to social supports, would you say that you do really well in this? Would you say that you don't have it at all? Are you somewhere in the middle? So you don't have to have a strong rating for each one of these. I think that's a little bit unrealistic because we all have our things that we can work on. But the goal is we want to kind of have at least somewhere in the middle for it. And then the ones that are a little bit lower, we want to work up. So for the first one, social supports. What is that? Social supports means that you can create relationships where you have the ability to talk about problems. When something is going on in your life and it's difficult and you're struggling, being able to call somebody up and be vulnerable and talk about issues and not hide from them or not try to pretend that they're not there or hide them from other people, that's a strong indicator of somebody who has a good social support system. So ability to talk about problems with people to ask for practical help. So if we have a lot of people in our life that are always willing to help, but they're not the most stable people, or they give us bad advice, or they encourage us to do things that aren't that healthy, yeah, you have a lot of people in your support system, but if they're not stable, they're not going to give you a strong, stable support system. Feelings of love, intimacy, and friendship. So again, you might have a lot of people around you, but if they feel like acquaintances, they're coworkers, yeah, you know them, but you don't really feel connected to them or a close friendship, or you don't have strong relationships in your life, or you've never been in a romantic relationship. It's okay if you haven't, but if you feel like you've never experienced love in a romantic relationship and you also don't have close love in your family, these are all indicators that you might have a lower social support system and something to work on. So let me kind of recap that. So the first category is your social support system, and you know you have a strong social support system if you have these three things, which was the ability to talk about your problems, having people that you can rely on or call on that are actually stable in themselves, and knowing that you have feelings of love, intimacy, friendship, connection with other people. Now, if you say, okay, I'm on the weaker side, that means that we want to take note of that and build it up. So what does it look like to build it up? Maybe you're becoming more vulnerable with people. Maybe you're connecting with more people. There's a lot of different things that you could do. And maybe I'll create a video specifically on how to increase it. But again, since I'm trying not to make this too long, just kind of evaluate those three things and tell me or tell yourself if it's weak, moderate, or strong, if you have a really strong support system, and keep track of it. Okay, second category is your coping skills. The first thing I want to say is, can you manage uncomfortable emotions in a healthy way? So when things get tough and you're sad, are you quick to run to the bottle of alcohol to make yourself feel better? Or are you somebody who is quick to run and journal about it or work out or do yoga or go to therapy? So we're trying to evaluate, do we do the healthy things or do we do the unhealthy things? Our own awareness of our emotions and how we handle them. So are you somebody who is even aware of how you handle your emotions? Do you take accountability for your emotions? If I ask you how you're feeling, do you know how you're feeling? Could you name how you're feeling? Are you in touch with yourself, and are you being honest with yourself about the emotions that you have? So again, weak, moderate, or in the middle, or strong. And you're going to rate yourself. And obviously we're not able to actually talk about it, but usually I would ask the person well, why is it weak, or why is it strong, or whatever. But you're going to rate yourself and keep note of it. Okay, the third one is your physical health. So the first thing is, are you getting adequate exercise or just physically moving around? It doesn't have to be strenuous workouts. It could be yoga to get in touch with your body and create stability and flexibility. It could be going on walks. It doesn't have to be you're at the gym all the time, but do you have that outlet where you're getting adequate exercise in your life? Are you eating a balanced and healthy diet? It's okay on the weekends, you go out with your friends. I don't even mean drinking. You could just go out and get dinner or whatever, and you know, you don't have the best meal or you eat fast food once in a while, like that's okay. But we want to make sure that we're giving our body the nutrients that we need and the vitamins and the minerals and everything like that. Medical compliance, so not everybody is taking medication. This might not apply to some people, but if you are prescribed a medication, like let's say that you have diabetes, are you making sure that you're taking the medication that you need to, or that you're checking your blood sugar? Like whatever it is that you know you need to do to keep yourself healthy, are you doing those things? And again, we're going to rate ourselves from weak, moderate to strong. And it's just an evaluation. Like if you look at those 3 things and you say, okay, yeah, I go for a walk once a day, a 30-minute walk, but I actually don't eat very healthy at all, and I sometimes forget to take my medications, well, you're probably closer to the weaker side because you're really not following through on most of those. Moderate might be you're doing 2 out of the 3, and then strong might be you're doing all 3. However you want to measure it. So you're going to keep track of that. I'm going to make a part 2, and we're going to go through the next 3, and then we're going to kind of talk about what it means if you have a lot of weaker categories or stronger categories. So thank you for watching this, and please head on over to the second one if you're still interested, and I'm going to try to keep that one a little bit short as well.